So today we'll be discussing the femoral triangle. Now, the femoral triangle is essentially a subfacial formation. It's right under the skin and it appears as a triangular depression. That's a wobbly triangle. To the inguinal ligament in the front of the thigh, the inguinal ligament extends about here to here in the front of the thigh, the anterior thigh. So it's a formation in the anterior thigh. Now we'll see the boundaries of this triangle. On the base, as we saw before, is the inguinal ligament. This over here is the inguinal ligament. Medially, we have the adductor longus muscle. This is the adductor longus muscle, this one. Laterally, we have the sartorius, this long sheet-like muscles that stretches from over here to here. And the apex consists of crossing of the medial and lateral boundaries of these two muscles. The lateral and the medial boundaries of these muscles. On the roof, we basically just have the skin and the superficial fascia and the deep fascia and the vessels and nerves in these fascias. Superficial fascia, which has the superficial inguinal lymph nodes, then the femoral branch of the genitofemoral nerve, which gives the nervous supply to this triangle, then branches of the ilioinguinal nerve, then the superficial branches of the femoral artery with their veins, and the upper part of the great saphenous vein, which drains into the femoral vein in this triangle. And then the deep fascia includes the cribriform fascia, which covers the opening of the saphenous vein into the femoral vein. As for the floor of the triangle, there is a medial part and a lateral part, and medially it's formed by the adductor longus muscle as well as the pectineus muscle. These two muscles over here, these form the medial roof of the floor of this triangle. Then laterally by the psoas major, which is not shown in here, the psoas major and the iliacus muscle. So that's it for the boundaries of this triangle. Now, for the contents of this triangle, it's basically a triangle for the vessels of the lower limb. So it contains the femoral artery and its branches, the femoral vein and its branches, tributaries, the femoral sheath, which we'll discuss later, nerves, which are all of these nerves, and the deep inguinal lymph nodes. Remember, we had superficial inguinal lymph nodes before, and deep we have the deep inguinal lymph nodes. Now the nerves, we have the big fat femoral nerve, then nerve to the pectineus, which arises a little above the inguinal ligament and gives innervation to obviously the pectineus muscle. Then we have the femoral branch of the genitofemoral nerve, which we discussed before, gives nervous supply to the roof of this triangle. Then the lateral cutaneous nerve of the thigh. And now we'll talk about the femoral sheath. So the femoral sheath, we can see over here, this is the femoral sheath. The femoral sheath is a funnel-shaped sleeve of fascia formed by the downward extension of fascia transversalis anteriorly, which means it comes from the transversalis muscle, and at the back, posteriorly, it comes from the iliacus muscle. So it's a funnel-shaped sleeve. You can see it's broad-mouthed in the upper part and just becomes narrower in the lower part, so it becomes sort of a funnel. And it merges with the adventitia of femoral vessels inferiorly. So inferiorly, it just becomes a part of these vessels and ends like that. The femoral sheath is divided into three compartments. That is the lateral compartment, which contains the femoral artery and femoral branch of the genitofemoral nerve. This little branch just manages to sneak in this compartment along with the femoral artery. Then we have the intermediate compartment, which contains the femoral vein, and the medial compartment, which is also called the femoral canal, which we will see further. So remember, we have that formation VA and vein, artery, nerve in intercostal spaces. So this is the vein, this is the artery, and this is the nerve which lies outside the femoral sheath. Same formation is in the femoral triangle. And the reason why this femoral nerve and this muscle is outside this compartment is that this space, this triangle, is basically a continuation of the iliopectineal space above. If you have time, look that up. And in that space, there's two compartments, one that contains the contents of the femoral sheath, and another that contains this muscle, the iliopsoas muscle, and the femoral nerve. So that's for the femoral sheath. Now we'll move on to the femoral canal. The femoral canal, its base is called femoral ring, which is bounded anteriorly by the inguinal ligament, posteriorly by the pectineus and its fascia, medially by the lacunar ligament. This ligament over here is the lacunar ligament. We'll draw that out. This is the lacunar ligament, which is this one. And laterally by the septum of intermediate compartment, this septum of intermediate compartment. See, this is the femoral ring on the upper side. Then it's closed by a femoral septum, which has a depression named femoral fossa. And for the contents of this canal, it contains a deep inguinal lymph node, lymphatics, and a small amount of areolar tissue. See, these contents are of minor importance, as well they are important, but as compared to these major nerves which are in the major vessels which are in the other compartments. So the reason why this femoral canal exists is that when there is a greater venous return to the heart, it gives space for this vein to expand, which is why it exists. That's it for the femoral canal. And this is the femoral triangle. If you have any questions, ask them. Until next time.